Hi everybody, this is Dr. Demetrios Kydonieus, chiropractic nutritionist, and today I'm going to be talking about my chronic pain program, which uses the radial pulse therapy or radial pulse wave machine, also known as a shock wave machine. It's a super strong vibration that when put on the tissue will actually break up old scar tissue, mobilize arthritis or calcium deposits to get improved range of motion. And over usually about 8 to 12 weeks with really severe cases of arthritis, like in the knee where it's almost bone on bone, we've been able to actually see joint space increase and put off a joint replacement therapy in some cases. Not everybody, but it works really well. It works great for torn rotator cuffs, and that's what we're here to do today, is to talk to one of my great patients, Miss Janet. And Janet had a old rotator cuff injury years ago, and it turned into frozen shoulder. You couldn't lift your arm for many years, and I've been taking care of you for quite a while, and you are now in your early 80s. And she decided to try the shockwave program, which was the shockwave machine or the radial pulse wave, which you have here, and then we followed up with what's called class 4 laser, which is a really strong laser that you need to get deep enough to get into the joint to stimulate the tissue to grow back normally versus growing back with scar tissue. So enough of me chatting. Tell the folks out there about your shoulder and how it was before we did the shockwave. We did chiropractic.
We did.
For over
5 or 6 years.
Many years. And we got here. We could never get it past this high, right? And then you did physical therapy for many weeks, many rounds, years, and did all the exercises, saw the PTs. Then you were a good patient. You did them at home and did all the shoulder stuff. And the shoulder, we figured, was stuck because we maybe kind of gave a little, we blamed it on being a little bit older and said there's too much arthritis in there. You didn't want to do shoulder replacement, which I'm glad you didn't. But then I kept talking about this program here. I know it was a little bit pricey, but we worked it out. And we did the shockwave and the laser program with you over about, I think, 8 weeks, 2 months. A couple times a week the first couple weeks, then twice a week for the end of the program. And what does your shoulder feel like now? And this is 6 months later.
Feels much better than it did. I can do things with it. I can actually open the door of the car, which I couldn't do before. I had to reach around with my other hand. I can push things. I can reach for a shelf that has been out of reach for quite a while.
Good.
So I'm feeling good.
And just kind of show everybody, how high can you raise your arm now? So that is about really 80%, almost 90% normal range of motion, something called abduction. Okay, so that's a huge improvement because nothing, not chiropractic, deep tissue massage, normal physical therapy, modalities, electric muscle stim, red light therapy, infrared, low-level laser, on and off over the 5 years that I've been taking care of you, and none of it really got your arm ever past 80 degrees until we did the beat it up a little with the chronic pain. So that is a huge, and now this is really 6 months since we finished. About it was right after Christmas, I believe, or the early part of the year we finished?
I would say so. I think it was more in February.
Or February, okay, so the beginning of the year. We had a little bit of, you love to garden, and she has a huge garden, guys. Bring me tomatoes and whatever. So, great food, but you're out there in the garden pulling weeds, planting, picking stuff, chasing the rabbits and the squirrels away, and taking care of the chickens, and you do all that much better now, I assume, correct?
I do.
Right now, I know this year gardening, it was a really hot summer, 2026, we're doing this video, and hot, and now it's really humid and hot as we're in August right now. And your shoulder started to get a little stiff again, didn't revert back to being frozen, but gave you a little. Now, we did one shockwave last week, and you're holding, you looked really good on the chiropractic table, and your range of motion was pretty good today, better than it was when I saw you a couple weeks ago. So just that one little kind of pick-me-up treatment kind of gave you more range of motion.
It did. and I'm getting ready to plant more fall crops, and I'm
Looking
excited. I'm looking forward to it.
Very, very good. So, um, anything you would like to tell other people, let alone seniors, but even the 50-year-old, let alone the 70 or the 80-year-old, about the value of doing this really new therapy, this shockwave with the laser, is how I do it in my office. Anything you'd like to share with those folks that are on the fence? Should I spend, the money? It's really tough. And how limited did you feel not being able to use your arm?
Well, first of all, there was the whole set of shelves that my kitchen I couldn't reach. So everything above here was out of reach. And of course, my husband didn't want me to stand on a stool, so it was out of reach, or I had to call him. And then because I wasn't feeling well, I let the garden get so weedy that I had to get out there and do all of that. And I've been out there using both hands, which is wonderful, because that way this side doesn't get totally exhausted and overused. And I find that if every now and again at night, if I put a heating pad on it behind my shoulder,
awesome,
I'm good.
Very good, very good. So you feel the value was there doing the program.
Absolutely.
I know it was a little pricey, but it has given you so much more quality of life. That's what really counts, right?
Yes.
So. Alrighty guys, well this is Dr. D and Janet signing off. If you have any questions, my information should show up on the bottom of the video here. You can email me, you can call the office. I'm in Ruckersville, Virginia. It is an in-person therapy. It's not something I can do over the internet. But have a great day and thanks for watching.